Hello and welcome. I'm Terry DeShanes Lamb with the Healthcare Partnerships team at MDA. Thank you for joining us today for the MDA Industry Update webinar presented by Mitsubishi Tanabe Pharma America. MDA's Community Industry Update webinars are programs which provide an opportunity for the community to receive information and updates impacting care and treatment directly from pharmaceutical, biotechnology, and medical equipment companies. These webinars are just a part of MDA's community education program. We encourage you to visit the community education pages of MDA.org. You will find an abundance of resources, informative recorded webinars, and listings for upcoming educational events. Of course, if you have any questions or need assistance, the MDA Resource Center is available to you by email at resourcecenter@mdausa.org or calling 1-833-ASK-MDA1, or you can reach the Resource Center on MDA.org. At the end of this webinar, you will receive a survey link. Please take the time to complete this short survey so that your voice is heard and you can help us create more impactful programming for future events. This presentation will be uploaded for on-demand viewing within the next few weeks. Additionally, you will be provided with links and resource information by Mitsubishi Tanabe Pharma America. Now, I'll be sharing a pre-recorded video with Dr. Jefferey Rosenfeld. Thank you again and enjoy this impactful presentation.
This video is sponsored by Mitsubishi Tanabe Pharma America Inc., MTPA. The speaker is presenting on behalf of and has received compensation from MTPA. The content in this video is not a substitute for independent clinical assessment or judgment.
Hello, my name is Dr. Jefferey Rosenfeld, and I'm a neurologist with a specialty focus in neuromuscular disease. And I've had the great opportunity over almost my entire career of taking care of patients with ALS. And there are many developments in ALS. This is a very exciting time in both understanding the mechanisms and the management of the disease. But it's also a time of some significant uncertainty and challenge, as we have some major questions that we wrestle with. For example, is ALS one disease, or is it many diseases with the same name? Do ALS patients each respond to the same medication in the same way? And in addition, are there certain medications that can help manage some patients with ALS better than others? We're going to go over these topics today. The purpose of today is not for me to provide any medical advice to you. Your doctor is the best source of information about your disease. ALS is a neurodegenerative disease that affects motor neurons. That means motor nerve cells that live both in the brain and in the spine degenerate over the course of the disease. Now, motor nerve cells that live in the brain, we call those upper motor neurons, and they send a signal down to the spine, which we call lower motor neurons. And the specific symptoms that you might have as a result of the ALS are completely dependent upon which motor nerve cells in the brain or in the spine are affected, and that's very variable. In ALS, these motor neurons degenerate or deteriorate, and they can disrupt these signals either from the spine or from the brain. We're continuing to advance our understanding of ALS. Ongoing research helps to develop treatments that may be able to influence the underlying mechanisms that are linked to ALS and hopefully stop the disease progression. In ALS, no two people are alike. That's probably very apparent to you already. ALS symptoms vary significantly from one person to the other, and that's based upon which motor nerve cells are affected. ALS can affect you in many ways. For some patients, it's mostly speech, swallowing, and sometimes breathing. For other patients, it's use of your hands, your arms, your dexterity. And yet for other patients, perhaps it's difficulty with your lower extremities, difficulty ambulating, getting up from a chair, walking, and so on. ALS can progress rapidly for some patients, and yet in other patients very slowly. And unfortunately, we really don't understand why there's that variability. When ALS does progress, a person can gradually lose physical strength, become weaker, which certainly can limit movement and the ability to have an independent lifestyle. If you know other patients with ALS, it's very probable that they're experiencing some symptoms that are different from those that you're experiencing. That's why it's very important for you and your doctor to identify the symptoms that are occurring for you, track how fast they're progressing, and try to intervene as early as possible. Talk to your doctor as soon as you can to determine how you can best manage your ALS. Managing ALS is a team approach. As we say, it often takes a village because the number and the diversity of the problems is so varied. Patients with ALS have a variety of medical needs that really depend upon their individual symptoms. The multidisciplinary team of professionals who treat patients with ALS on a regular basis can best provide you with a care plan that's tailored to your needs, to your aims, to keep you as mobile, as comfortable, as independent as possible. For example, a speech pathologist can help you if you're having any difficulty speaking or swallowing. An occupational therapist can help you with adaptations or changes to how you perform your daily activities. A physical therapist can help you with your ambulation. There are many, many resources available and hopefully within reach, so that you must know that you don't have to go through this ALS journey alone. I want to emphasize the importance of setting realistic expectations with treatment. The treatments that we have available today are very significant, but they don't necessarily cure or reverse the disease of ALS. They have the potential, however, to manage symptoms and to slow the progression, slow the motor neuron degeneration. And once you start a treatment, you may not feel an obvious change, or certainly you may not feel an improvement, but the overall goal of most treatments is to maintain your function for as long as possible and to slow the disease progression. Our limited knowledge of how ALS develops and progresses in the body has definitely been a barrier for the creation of new therapies. Many potential drugs have been studied over the years, but only a few treatments have been approved by the FDA. 2 of these approved treatments include RADICAVA intravenous formulation, which was approved in 2017, and RADICAVA ORS, or an oral formulation, which is taken by mouth or through a feeding tube, that was approved in May of 2022. Now, both of these have the same active ingredient called edaravone, and exactly how edaravone works is not known. But earlier studies have shown that edaravone is thought to reduce what we call oxidative stress. That's a type of chemical reaction or a process that's believed to cause or contribute to nerve cell damage and motor neuron death. With RADICAVA oral formulation, there is a treatment option that you can take by mouth or through a feeding tube. So make sure you talk to your doctor to determine if that treatment plan is right for you. RADICAVA ORS offers the same benefit as RADICAVA to help slow the loss of physical function. The benefit of RADICAVA was demonstrated in a clinical study. At 6 months, RADICAVA slowed the loss of physical function by 33% compared with placebo. This means that patients who received the RADICAVA had a slower decline in physical function compared with those who did not receive the RADICAVA. RADICAVA ORS offers the similar safety profile as RADICAVA. There are serious side effects that have been associated with RADICAVA ORS as well as RADICAVA intravenous, including hypersensitivity allergic reactions and sulfite allergic reactions. Do not take or receive RADICAVA ORS or RADICAVA if you are allergic to edaravone or any of the ingredients. The most common side effects with RADICAVA ORS and RADICAVA intravenous are bruising, problems walking, and headache. Fatigue was observed in patients taking RADICAVA ORS as well. It's also important to know that fewer than 6% of patients discontinued RADICAVA ORS due to side effects, as was shown in that 6-month study in 185 patients with ALS. And approximately 1% of patients discontinued due to gastrointestinal side effects, including diarrhea and trouble swallowing. The other reasons patients stopped taking the medication in 1.1% included respiratory failure and muscular weakness. So again, be sure to talk to your doctor about the benefits and risks of any medication that you're considering. RADICAVA oral formulation and RADICAVA intravenous have the same dosing schedule. So if you're currently taking the intravenous formulation and you're considering to switch to the oral form, you're already familiar with which days you will take the medicine. You should know that there is a fasting requirement for RADICAVA oral. You should take it on an empty stomach in the morning after fasting overnight for 8 hours. You shouldn't have any food or drink except for water for 1 hour after taking the medication. RADICAVA ORS, or oral formulation, is a liquid dose that's taken by mouth with an oral syringe, or it can be given through the feeding tube. Make sure to take your medication as prescribed by your doctor. In my practice, I have had the opportunity to use both RADICAVA intravenous formulation as well as RADICAVA oral formulation. And based on the clinical studies, we know that these medications can help slow the progression of ALS. But there is no magic bullet or one size fits all for all ALS treatment and for all ALS patients, because ALS affects each person differently. So the treatment and the management should be specific to each person and aligned with their treatment goals. ALS research has never been so robust and energized as it is today, with pharmaceutical companies continuing to prioritize the needs of patients with ALS. Before I give you my final thoughts, here is the important safety information for both RADICAVA ORS and RADICAVA intravenous.
RADICAVA edaravone and RADICAVA ORS edaravone are indicated for the treatment of amyotrophic lateral sclerosis, ALS. Do not receive RADICAVA or RADICAVA ORS if you are allergic to edaravone or any of the ingredients in RADICAVA and RADICAVA ORS. Before you take RADICAVA or RADICAVA ORS, tell your healthcare provider about all of your medical conditions, including if you have asthma, are allergic to other medicines, are pregnant or plan to become pregnant. It is not known if RADICAVA or RADICAVA ORS will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if RADICAVA or RADICAVA ORS passes into your breast milk. You and your healthcare provider should decide if you will receive RADICAVA or RADICAVA ORS or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of RADICAVA and RADICAVA ORS? RADICAVA and RADICAVA ORS may cause serious side effects, including hypersensitivity, allergic reactions, and sulfite allergic reactions. Hypersensitivity reactions have happened in people receiving RADICAVA or taking RADICAVA ORS and can happen after your medicine has been given. RADICAVA and RADICAVA ORS contain sodium bisulfite, a sulfite that may cause a type of allergic reaction that can be serious and life-threatening. Sodium bisulfite can also cause less severe asthma episodes in certain people. Sulfite sensitivity can happen more often in people who have asthma than in people who do not have asthma. Tell your healthcare provider right away or go to the nearest emergency room if you have any of the following symptoms: hives, swelling of the lips, tongue, or face, fainting, breathing problems, wheezing, trouble swallowing, dizziness, itching, or an asthma attack in people with asthma. Your healthcare provider will monitor you during treatment to watch for signs and symptoms of all the serious side effects and allergic reactions. The most common side effects include bruising, contusion, problems walking, gait disturbance, and headache. These are not all the possible side effects of RADICAVA or RADICAVA ORS. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to www.fda.gov/medwatch or Mitsubishi Tanabe Pharma America, Inc. at 1-888-292-0058. Please see full prescribing information and patient information on RADICAVAORS.com.
ALS is a neurodegenerative disease that affects each person differently. It can be a relentless disease that progresses over time, but most importantly, you must understand that ALS is a treatable disease in the sense that there are approved treatments that have been shown to slow down the disease progression. A multidisciplinary team can provide a tailored plan to help patients with ALS manage their symptoms and advise them on the best care for their needs. ALS can progress rapidly, so you should talk to your doctor about starting treatment as early as possible to help manage your ALS and to slow the disease progression. Thank you, and I certainly hope this has been a helpful presentation for you today.
We hope you enjoyed this presentation. Please be on the lookout for a registration invite in your email for our next presentation in this series with a perspective from an ALS clinical coordinator. Additionally, you'll be provided with links and resource information by Mitsubishi Tanabe Pharma America in a follow-up email. Thank you again. Good evening.